welcome to the Ontario Caregiver organization's webinar series. These webinars bring together caregivers and subject matter experts to explore topics that are of interest in caregivers. And we do this to support and engage chosen family, friends, and neighbors who are caring for someone. I'm Katie McDonald, and I'm going to be your moderator for today. I am joining you today as from a professional background working for Ontario Caregiver organization, as well as a personal background as a lived experience caregiver as well for my wonderful brother and my mom. So I am here right there with you, all the caregivers joining today. And so just before we get started and I turn it over to our guest speaker, I just want to begin by taking a moment to acknowledge that the lands that we're on today. And while we're meeting on a virtual platform, I want to take a moment to acknowledge the importance of the land, which we all call home. So for me in particular, participating in the long-standing Indigenous tradition of acknowledging the land with mindfulness and intention is really important to me because I have spent my life growing up in Brantford, which if anyone's familiar with Brantford, it's a town that neighbors the largest reserve in North America, the Six Nations of the Grand River. So this in particular, being so closely connected, compels me to understand and to share the legacy of the Indigenous people of this land, the past, present, and the future. So the Grand River Valley is the traditional lands of the Anishinaabe, the Haudenosaunee, and the Neutral Nations. And these nations shared the lands under the Dish with a One Spoon Wampum Agreement, which was an agreement to share, work, and protect the lands together in harmony. And this territory is part of the Haldimand Treaty of 1874. So as a settler on these lands, I draw a great privilege from calling Brantford my home. It's where I work and live and play. And I'm grateful to spend countless hours on the river and the nearby forests. And they are my refuge, and I wish to acknowledge the Indigenous people who have been stewards of this land from time immemorial. So I invite you to take a moment to reflect on, with gratitude, where you are located today. And if you'd like to learn more about the lands that you're joining from, you can learn more at nativeland.ca. All right, so in today's webinar, we're going to explore the Canadian Caregiver Assistant and Referral Tool. So this is what we're going to now be referring to as the C-CART, a little bit easier to remember. So I will say that one more time, the Canadian Caregiver Assistant and Referral Tool. This is a user-friendly online tool that's been developed and designed for family caregivers to help identify their needs and then connect them to local resources and services. So by answering a few simple questions on the online tool and the online assessment, caregivers can receive personalized recommendations. So in the webinar today, we're going to learn about the tool, why and how it was developed, how we can use it. We'll actually get a walkthrough. You'll get to see it in action, and then how we might see it expanded in the future, especially as we enter the newest age of digital technology, being AI. So I'm really thrilled to invite Dr. Adriana Shnall she's as the program director of the Baycrest Koschitzky Center for Innovations in Caregiving, another mouthful. Dr. Shnall is an experienced researcher, educator, clinician, and subject matter expert in family caregiving and gerontology. Her passion lies in understanding the profound impact of dementia on individuals, their families, and the caregivers and healthcare providers as well. So I would love to invite Dr. Adriana Shnall to join us to introduce this tool, and I will turn it over to you, and I will join back towards the end. And thank you all for being here. Remember, you can always use the chat if anything comes up throughout. Any questions, you can use the chat to connect with us. Take it away.
Thanks so much, Katie, and thanks for that introduction. And, you know, it is such a pleasure and an honor for me to be speaking with you today. I've been around in this business for a very long time. I started supporting caregivers before we even had a terminology for it. I started this work in 1990, December of 1990, when I started as a social worker in the memory care clinic at Baycrest. And I started to realize very quickly that it wasn't the patients that needed the help, because in the population I was working with at the time, they didn't know they needed help. But it was the families that were really struggling a lot. And it became very evident to me that we need to figure out how to support families better through this. Since there were no cures for dementia then, we still don't have any cure 35 years later. But that's where my path, and of course, then I didn't escape the realities of having family members, grandparents with dementia, now more closely families that is closer that I can't really talk about because I'm in that weird stage of nobody knows stage. So I research about caregivers, and I teach healthcare professionals, and I teach graduate school at the University of Toronto students that are going to be in this field. And it's a real passion of mine. And I'm giving you all this context because I think it's important to realize that this idea of supporting families or chosen families has been a long time in coming. And now we finally, in Canada, have more terminology for it. We acknowledge it, and we have something like the Ontario Caregiver Organization to support families. So I'm really grateful for that. Today, I'm going to give you some context, which I just started to do. I'll talk about the development of this tool, C-Card, how to use it, how to access the resources and information, and things coming down the pipeline in the future. And before anything, I just want to share with you some terminology that I'm comfortable with and some that I'm not comfortable with. I use the term family caregiver, not because only family is a caregiver, there's friends, chosen families. It's just because that's what people understand, because we get busy sometimes talking about informal caregivers, and nothing could be further from the truth. It's not informal what you do, or unpaid caregivers, and that's very true. You're all unpaid caregivers, but it shouldn't be that way either. So I was told once, I started using the terminology carer and care partner, and I was told once, nobody knows what you're talking about. Caregiver, most people understand, so I'm not wedded to the terminology. It's just that if people understand me, that's what I care about. I've heard in the literature people calling it natural caregivers. You decide if that works for you. I heard Dr. Bruno, he is Cree, and he talks about caregifting. He has 2 sons with autism, and he feels, and in his tradition, it's been a gift to him to parent his children. So just for you to think about. And the term that I never use is the term loved one, because we all know that even though we may be caring for somebody who's close to us, there is no love lost. There's a long history of conflict. And so that's a judgmental kind of terminology. So I won't use it, even though you'll hear this where your loved one, your loved one. And the truth is, for most people, it is their loved one, but not for everybody. So I just wanted to say that. Also, within the context of caregiving, it's really interesting to me because the last stats Canada did, there's 54% of women doing caregiving, 46 men. But what's not quite so true when we say these things is that women are still doing the bulk of the work. And the way Stats Canada defines caregivers is by tasks. So if you drive your parent to a medical appointment every other month, you're considered a caregiver already. If you live with somebody and do 24/7, you're also a caregiver. And so both things are measured the same. And so I wanted to be understood that it's still women's work, the bulk of it, even though it's evening out and the care looks different. It's still not the same. 1 in 4 people in Canada are providing support to somebody else. And I'm not going to bore you with the stats, but a lot of people don't even know they're caregivers. But you, because you're in this webinar and signed on, what it tells me is that you know you are caregivers. And so you're ahead of the curve. Research shows that people like you that already identify as caregivers are more likely to get help and do a lot better overall from a physical, mental, emotional, cognitive perspective, because you've identified yourself to be a caregiver and therefore are getting help, like attending webinars. So good for you. The other thing I wanted to talk about is, and because this impacts when I talk about the C card, why it is so difficult to create is because every caregiving situation is different. And a lot of people will tell you that if there are 8 million Canadians who are caregivers, there are 8 million different experiences. And this is no coincidence. It's because there's different cultural backgrounds and traditions. So I have a colleague who's Southeast Asian, and he's the oldest child, and he's not a child, he's the oldest son. And so he was tasked with looking after his ill mother, but of course he worked. So it was his wife who quit work to look after her mother-in-law, and in his community, that was what was expected. So we all have within our cultures different expectations and roles that we play. There are also situations where there are multi-generational homes, where you have grandchildren looking after grandparents, children looking after parents, grandparents looking after children. And so that changes the picture as well. There's gender roles, expectations, what we expect the dutiful daughter in certain groups and cultures and their roles. And we'll see commonly, again, gender roles. The sons will give money towards the care, the daughters will provide care. And again, I'm speaking in generalizations, but just to give you a flavor of the differences in people's experiences. And then community support, people that come from collectivist cultures. So I'm born in South America, in Argentina. Community is very important. So I may be more likely to get more support than somebody, quite honestly, that's Canadian born, that is their family is all over the place and they are not connected to any organization, religious community, or whatever that may be. It also, whether we live in an urban area or rural. Urban areas, I'm in Toronto, we have a lot of resources. The problem is we also have a lot of long waiting lists for everything. If you live in a rural area, your issues may be different. Transportation may become very important, but you may have a stronger community, neighbors and people that you know well. There's also provincial differences. For example, not every province has a caregiver organization like we have in Ontario. And resources vary depending the province or the territory where you live. There are other very important factors like education, income. We know income is related. If you can afford services and pay for services, that's a different experience. And whether we like it or not, we do have some sort of a two-tiered system where people that can afford it will hire private help because we may not be getting enough from government agencies. The type of relationship matters. So if it's my partner that I'm looking after, that's very different than if it's my sister, if it's my child, or if it's a neighbor. And the research shows that the closer you're with the person, the more strain that it causes the caregiver. The stage of life is crucial. So if I become a caregiver in my 80s, it's more of my partner. That's different. I may not be working. However, I may have frailty and medical issues myself. If I enter caregiving in my 50s, I may have children I'm still involved with. I may have parents and still be in the workforce. So that has huge impact. The health of the caregiver matters. If I'm healthy and able, that's very different circumstance than if I'm not. My support network, who do I have that actually I can count on as help? And we know the larger the support network, and that's just not knowing people, but people that actually will be there to help you if you need to, that you can count on. My work demands, I have different jobs. I teach at the university. I work at least 10 hours a day. My situation would be very different than somebody who works part-time. And some people, I have flexibility in my job, other people don't, and that has huge impact as well. These days, access and comfort with technology really matters. For example, my mother, every time her iPad blinks, she's like, everything's disappeared. I have no contacts. Oh my God, I don't know what to do. I'm lost. She feels everything. She presses a button in her laptop, everything's disappeared. She goes into panic mode. That's a different, so she doesn't want to touch it. That's very different to people, my son, who's our tech go-to person, who doesn't worry. He knows nothing's disappeared. He's very comfortable with technology. And why wouldn't you use technology? We know there's language barriers, stages of illness matter, so end stages, so of cancer, of a terminal illness, or dementia, which is considered a terminal illness, looks very different than the diagnostic stages when you don't know what's going on and the anxiety that brings. And our ability to know about the illness we're dealing with has a huge impact in the outcomes for people. So the more you are confident about what you're doing, and attending webinars builds your confidence and education, the better you will do. And the other piece is the trajectory. So did you become a caregiver all of a sudden? Your parent had a stroke, was previously independent, living in their own home, driving, doing their day, had a stroke, and now is immobile. That's a different situation than if it's been gradual and progressive and slow going, and you've had a chance to adjust to it. Also, the research shows that the longer we're a caregiver, the more strain that creates. So there's an association between time and burden. And again, when I say burden, I don't mean to say that every situation is a burden, but most caregivers can make meaning of their situation. But given a choice, would you like to be in this situation and the person you look after have the illness you're dealing with? Most people would say no. And then transitions are a really difficult time for caregivers. So if the person you care for is hospitalized, that period is stressful. If the person you care for goes into long-term care, that is stressful as well. So I'm laying the foundation for you to get an idea of how complex caregivers have it, that there's so many moving parts to being a caregiver. There's also social isolation, because sometimes you don't have time to go out and be with friends and do your thing. And it's easier to stay home and do what you must do instead of reaching out for help. There's stigma depending on the condition of the person you're helping. Some mental illness still has more stigma. Dementia has more stigma. There's a lack of preparation. We don't go to school and learn about being caregivers, although we should have this in all our kids in school should be learning about what it is to be caregivers, given that most of us will be caregivers at some point in our lives. There's limited resources, and when there are resources, we don't know they exist. There's the emotional and the physical strain. So imagine being a 7-year-old, have arthritis, and you're looking after your spouse who's bigger than you, who needs to be lifted. There's a depression that goes with it and anxiety. Those caregivers are in the workforce. There's inflexibility. I mean, we're trying to fight and advocate for more flexibility in the workplace, but it's not true for everybody. And then there's cultural and language barriers as well. So these are all the things caregivers deal with. On top of it, if you want to put an overlay of navigating our healthcare system and a social care system is difficult. You have people with masters of social work degrees that do this for a living and still don't know all the resources. And this is a problem. And this is a problem because sometimes we feel there are no resources for us. But it's not that the resources are not there. It's just that the resources that exist, you don't know about. And the people that are trying to help you don't know about. And this is hard. This is hard. And because resources come and go, and healthcare professionals come and go, it becomes even more difficult to figure out what's in existence. And websites are not necessarily updated. And I can show you a lot of websites for a lot of organizations with material that when you click on it, it no longer exists and nobody's updated it. And that's also what happens when we have so much information out there, that it's hard, even for organizations that are top-notch organizations, to keep everything up to date. And it's not that it's hard because they don't know how to do it. It's a matter of resources and funding for the most part. We don't tend to give money for technology and to keep up all the systems that we need to keep up with. So we know the research shows it's very clear. All types of caregivers need education around the disease they're dealing with, emotional support, social supports and community resources. They need skills to manage illness. So for example, if you have to catheterize the person you're looking after, you got to learn how to catheterize somebody. I mean, in Ontario now, we used to have more nurses that came and did home visits to do medical treatments. Now the nurses will come and teach the caregiver how to do it, and it's on you to do it. I'm not saying that's good. I'm just saying this is our system, and it's on caregivers' backs that the system is working. But we just don't have those resources anymore. So if you're the caregiver for somebody with a dementia, you need to figure out and learn how to manage behaviors of dementia. If somebody is trying to get out or is agitated, what do you do? That's important education that you need. Financial support, huge issue. Did you know that only 8% of Canadian caregivers avail themselves of tax credits? We are advocating for to really get financial support as opposed to a tax credit. We'll see. And really is figuring out when something happens. So your sister falls and breaks a hip, and you're like, I'm it. What do I do next? Who do I call? That's the time that we need help with system navigation. So there are a lot of things that can help cope, but what I want to focus on today is the C card. We developed an app also, but the website for caregivers to find the support they need and where to get it. And the reason is because really people don't know where to find it, and they don't even know what exists. So you don't know what you don't know. And how are you going to know that perhaps there's a service that gives you financial support and there's a tax credit when nobody tells you? The government's not advertising, here, come get some money, or there's renovation grants for your home. Like, they don't have that on TV. And so how would you know? So you wouldn't even know to ask because you don't know that it exists. And this is where the tool can be helpful. And when we were developing this tool, we had family caregivers, healthcare professionals, researchers, all involved in the making of this. so that it made sense. So a few things about the tool. It's free, it's anonymous. You will see when we go through it that we don't ask any information that could give you away. It's confidential. We don't store any of the data, and it connects you to the appropriate resources. We've spent a lot of time and money and resources to make sure that it's safe to use, that nobody's compromised. I mean, Baycrest doesn't want to be known to be a place that would produce a tool and lo and behold, it's hacked and all the data is at risk, because we're not keeping data anyway. And you will see as we do it. Only in the app, you keep the data, but it's stored in your own personal phone. So then that's not risky. It's really, this tool is designed for, even though I specialize in dementia caregiving, we designed the tool for all types of caregivers, regardless of age or stage of the person or illness that they're dealing with, and cultural background or gender identity. So any caregiver in Canada should be able to use it and find resources for themselves. And we've made sure that all the information that we provide is evidence-based information. It's tailored to your needs. And there's areas that we know that caregivers need support with. One is emotional and physical health, understanding around the condition they're helping with, which resources are available and how to access them, and really to develop skills to provide care. And through this app, you can keep using it periodically as needs change, because we know in the trajectory of caregiving at different stages, you and the person you care for need different things. So you could use the app over time, also because new resources come on board, and some that existed before no longer exist. So we really, when we developed this, we really compiled a lot of Canada-wide resources for caregivers of all conditions. It was a humongous task, you can only imagine. We had caregivers co-design it with us. And we created a series of 15 questions that leads you to the right resources. And there's reasons why some questions are there and some are not. Nothing was happened by accident, and nothing that we didn't think through very carefully. And so we launched the website in November 2024, and we launched the app in 2025. So I'll walk you through what it's like. I'm not using the app because it's hard for me to share my phone, but you can download it through your App Store or Google Play as well. It's free of charge. I'm going to show you, and it looks different. The app slightly different because it has to be able to fit in a phone in a smaller screen, but the information is the same. And this is what fancy people call MVP. And that's not about sports, but it's most viable product. And this is the beginnings, and I'll show you after how we're improving it. Okay, so this is this version as it lives now. So I'm gonna go through it just to give you an idea how it works. So what is the age of the person you care for? And you'll see there's huge age groups. It's just, again, because we don't want to identify anybody, right? So I'm going to say the person I look after is 65 and over. What is your relationship with the person you care for? I'm the daughter. What setting does the person you care for live in? I'm going to say in their own home. Which province does the person you care for live in? I'm going to say Ontario. Does the person you care for live in a rural or urban area? I'm going to say urban. And that's as much as we ask in terms of cities. Like, we're not going to say Toronto. We just care if it's urban or rural. Is the person you're caring for a veteran? No. Okay, let me say yes. And this is because veterans have a lot of services available to them that other people don't have. And are they registered with the Department of Veteran Affairs? Yes. Does the person you care for identify as an Indigenous person in Canada, such as no? And then what is the condition the person you care for? Check all that apply. So I'm just going to use, because this is depression, dementia, and diabetes, and vision loss. Show next. Would you like to find out more about information about any of the following? And again, check all that apply. Home renovations. Yeah, I'm interested. I'm interested in advanced care planning. I want to know about applying to long-term care. And I want to know about caregiver support groups. And here, what are some barriers you encounter in your caregiving experience? So I really don't know where to get help. That's my number one, and I have financial concerns. I'm just going to leave it at that for the sake of time. Where do you go when you have a question, concern related to the condition? So I tend to go to my pharmacist, to the Ontario Caregiver Organization, and the internet. How often do you engage in self-care activities? Because this tells us about your well-being, and I'll say sometimes. And this is a question about mood. In the following, the number of days in the last 2 weeks you've been impacted by the following: you have little interest in pleasure in doing things, more than half the days. I'm feeling down, depressed, or hopeless, several days. How often do you have financial concerns about covering your basic necessities? Sometimes I'm worried. Do your caregiving responsibilities negatively affect your employment? Yes, because sometimes I call in sick because I'm a caregiver and I don't know what else to do. Oh, yes, so I meant to say yes. How have you been affected? Well, I had to take a sick leave. And the following questions are just to help us improve and know who's using it. I am 55 to 64. I live in Ontario. I live in a urban area. I'm not Indigenous. I'm Caucasian. Which of the following describes your current gender identity? I am a woman, identify as a woman, and I'm employed. And then I just say, we say thank you, and then we continue on to the resources. So C-Card does its magic. Here you have a click so that I can save the resources for the future. I'm not going to do it now because I don't need it. I just want to show you. So the first thing that comes up is, for me, is 211. The reason for it is because even if you get nothing else out of here, did you know, and a lot of caregivers don't know, that 211 is available 24/7 in over 150 languages, and you can call somebody and speak to their situation, and they'll refer you to the right resource. So if English is a concern, 24/7 is a concern. If you don't know where to start, if nothing else, start there. Because you're here participating in this webinar, it tells me that you must speak English or understand it well enough to participate. But it's a number that it's easy to remember, And if nothing else, that's available to people. The other one's 811. It's 24/7. And this is for Ontario. It gives me the Ontario resources. If I would have clicked Saskatchewan, if I would have whatever, BC, Newfoundland, it would give me something different, although 211 is throughout Canada, and so is 811. The next thing that comes up, because I live in Ontario, is the Ontario Caregiver organization. And this one is you're already connected. So you're already the converted group. But most people, unfortunately, don't know of its existence. And then it comes up, and so I'll show you. I don't want to leave the website because I'm on mode, but if I clicked any of this, it would take me to the website. So if I had to leave work early, I may want to know about how my CPP's been affected. I may want to know about different financial EI benefits that exist. So it will take me to the website so that I can, and I'm not saying it's easy to navigate these websites, the government websites for finances, that's a whole other webinar, but at least you know where you should go or ask somebody to help you within that website. Then because I said that I have, I'm dealing with somebody with depression, diabetes, dementia, and vision loss, which a lot of those co-occur a lot in the elderly. Then I have, and they said I wanted support groups. It takes me to all of these resources. And I said I wanted to know about advanced care planning, then into the OHH. It's still, the name keep changing, but it's still the same link. And then information about depression, and then some educational resources. And then it lets me go into a survey if you want to do it, just to give us feedback if this was helpful or not. If I don't have time to deal with all of this, I can save the resources onto my computer and access the links when I have time, or share them with my family member, my son, whoever that may be. And just like a few things that just for you to feel safe, that we're not taking information, we're not selling information. Safety and collection of information is very important. We do what it's called also code reviews, and don't ask me what that is. We have a systems developer, an engineer that works with us full time on this. And we have companies that we pay for security that make sure the code is up to par, that there's no gaps in safety. We work with a designer to ensure that the tool is engaging and easy to navigate. But if you download the app as opposed to this laptop version, you will see that already has upgrades, and we continue to embed upgrades. But again, because we have to go through code review every time we make a change, and it costs $8,000 for code review, we can't just daily, as we have upgrades, do it. We have to save a whole bunch of upgrades and then do it together, just so that you know we're getting an upgrade today. So if you test it and it happens to be during the 1 minute that the upgrade is happening, the system will be down. So don't be discouraged. It's just that we're doing an upgrade. And this is such as technology. And it shouldn't, our IT guy, our engineer said that it shouldn't take more than a minute for the upgrade to happen. We've really done a lot of piloting with different caregivers in the country, really. And we've done a lot of outreach with physicians, because we want this to also be of help to healthcare practitioners. Because, you know, like if you're lucky enough to have a family doctor, you go to the family doctor, they're very busy, you have your few minutes with them. They don't have the time or don't have the experience or knowledge to tell you which where to get help. But if they can at least share with you, here's this resource, and you'll get the links to the information, that's huge already. The other things that I really want to acknowledge the support we've had from the Caremakers, Petro-Canada Caremakers Foundation, RBC, the University of Toronto, and the Slate Foundation to develop this and to keep it going and to keep improving it. And we have a lot of things happening in the future. One of it is we're building a specialized one for dementia, because if you use it, one of the downsides of this program is that it'll give you information. But if you already know the basics, it won't give you your local across the road organization that could be helping you, or the exact educational material above and beyond what's basic. Because you can only imagine what the level of education and resources we need. Again, things, all caregivers of all Canada, of all conditions. So we're developing more specific C cards, one for dementia, one for geriatric conditions. We're developing one for mental health, one for developmental disabilities. All those are coming down the pipeline. I'm partnering with experts in those fields that can give as the best educational material and resources. They already have it. We don't have to reinvent the wheel. We just want to know, we're vetting it for everybody. We're saying, yes, this is good quality. These are great resources. I'm comfortable for them to be part of CCARD. Through AI, and nothing to be scared about, AI helps us with things like we can have more real-time chats with prompts. Instead of right now, when you use the app, it feels kind of like a questionnaire, like a school project, not a school project, but it's like, you know, click here, click here, click here. We want to have it so that it's smoother, so that you don't have to click as many things, so that the prompts already, AI can predict already the kinds of things to ask you. And it can be more precise than we could ever program this. AI also has the ability to find broken links. So as organizations are, new organizations are appearing, some are disappearing, it will flag it to us so that we can correct that information. That would be very helpful, because again, think Canada-wide, like how do we keep track of all these things? We really need to, we depend on people to do the evaluation at the end of the survey to give us feedback, because that's how we improve it. We're going to have more voice input features for people with physical or visual limitations. It should be more intuitive. And we really, this has been a collaboration of so many professionals everywhere that it's been very exciting for us. Some final thoughts, because I'm very aware of the time, and so that there's time for Q&A. Caregiving is hard. Like, there's no way around it, but there are supports, and they exist. But it's just finding where they are, taking advantage of them. And those of you, you know your caregivers, you're already halfway there, because then at least you know that you can ask for help. And tools like CCART, the Canadian Caregiver Assessment and Resource Tool, are really here, hopefully, to help you get to the right resources so you can have a bit of an easier time through it. So this is it, the formal presentation. I'm going to stop sharing my screen, and I'd love to hear questions from the audience.
Thanks, Adriana. That was great. It was so cool to see it in action. So thank you for walking us through that. And there have been a lot of comments in the chat just about how helpful the tool is, and a lot of people really seeing it for the first time, and that it looks promising, especially with like the next generation that you were talking about. So lots of positive feedback there. One of the questions was about the funding for it because it is free, and I think you addressed that with a lot of partnerships and grants and supporters along the way. Yeah, and so I guess to extend that question is. As you're talking about next generation, does it seem like there's that appetite and kind of more people continue to be lined up to support the next generation of the tool?
Yes. So, a lot of what I do is I need to go look for money because, as you all know, it's hard to get government dollars to create these kinds of things for now. So we rely a lot on corporations, and luckily, a lot of corporations have a foundation arm to them. And so we also rely on places that are innovation for older adults, like kind of places that fund researchers and innovators like myself. I'm always looking, a big part of my job is going, presenting, talking, because one thing that is very clear to me and very important to me is that it has to remain free and available to everybody. But of course, technology costs. And so we're not doing any advertising. We're not selling. We're just, over time, there's costs associated with running this. I'm not worried about the money piece of it because there's a lot of interest and a lot of growth. I mean, this is one of the number one problems for Canadian caregivers, healthcare professionals. If we can deal with the system navigation problem and figuring out what resources are there, we'll be doing really well. And so if this works and is helpful for people, there will be funding. I mean, I do hope at some point the government kind of says this could save us a lot of money. Like even like physicians on like that are by themselves, people that are sitting in their own homes in the middle in rural areas, right?
Sure.
Like we don't have a solution for the problem of figuring out what resources people need and where to find them.
Yeah.
So we're very hopeful that that this can tackle it. Technology is moving so fast. This is the other piece. When I had this idea about over 3 years ago, I had this idea. It's like, how is it going to happen? And then AI and like, so things are moving quickly. Technology makes it easier and harder all at once.
Sure, sure.
So
That's a good way of putting it. I think there's been a lot of comments too about that the resource looks great and people will be sharing it. So I do think that in addition to family caregivers, we also have a number of care providers and practitioners on the webinar today who are coming to arm themselves with yet another great way and resource to support family caregivers. So for those of you who are here joining in that capacity, we thank you for being here. And they're definitely that they're going to use it to pass on. So yeah, that's fantastic. And we have something similar actually on our website, on the front page of our website. That it's not quite as detailed as the C card, but it's the same idea of, as you've mentioned, the internet can send you down a million rabbit holes, and how can we get the information that we need faster? And so we also have a mini assessment on our website that does a similar thing. So it doesn't pull the whole internet like yours does for resources and services, but what it does is it kind of like condenses for people what's available, like what OCO has available based on your caregiving experience, your caregiving situation. So if you're looking at a specific topic of, let's use similar to the one that you just used, dementia, it will pull and curate a list for you from our website of the podcasts and the webinars that we have and the resource guides that we have, and anything that we also know is kind of put through the same filter, for example, and kind of collates that for people. And we've had a lot of really good feedback because as we know, caregivers' time is very, very valuable. And the easier we can make the connection to the resources, the better, right? So I appreciate that. There was another question that I wanted to ask you about, because it kind of gives another bit of a scenario. We had someone who was asking about an example of how this could be used to help a caregiver who cares for someone who is in long-term care. So, knowing the filters that are in there and the prompts that are in there, could you kind of like give some ideas of maybe some of the directions that someone would get if they were, in that specific caregiving situation?
So it's funny you say that because we've also developed, it's called CCAN tool, which is a family assessment to family caregivers of people whose relative have gone into long-term care. Because the issues, there's this belief that once you place your relative, you're out there, you can go party. It's like you're not a caregiver anymore. And nothing could be further from the truth. It's a time of really crisis for families. You have to trust somebody else to care for your person. You may feel guilt. There'll be financial implications. It's what if you don't like the staff? In Ontario, unfortunately, families have very little choice into what facility people go into, and there's long waiting lists. So we do have a tool that's related to that. My suggestion to you is that you go for long-term care and then the counseling part, the mental health, because really, and the financial, it depends well, I shouldn't say that. It depends what about the long-term care facility, because it may be for you transportation that your person went 50 kilometers away and you can't visit. So depending on what about the long-term care experience is, you can click those, right? So what your issues are.
Mm-hmm. And I think when you and I were speaking earlier, you had mentioned that even just going through the assessment, it can help caregivers in the sense of it can bring a greater awareness to some of the obstacles and the challenges. I mean, we live them every day, don't get me wrong, but we live them and operate in them and doing the best we can. But when we are asked direct questions about them, we can kind of develop some self-awareness around like, yeah, that really is a barrier to me. And maybe something we wouldn't even think, like you said, when we were chatting, you wouldn't even think to reach out to look for extra support on. So just even your example of, transportation. So I wanted to bring that up because I think that, just going through the assessment is a great exercise in kind of helping us create like you said, a priority list. Is it transportation? Is it the finances part of it? Is it mental health? And for a lot of caregivers, it's all of them. But we say, we can only kind of tackle so many things at once. And so to be able to prioritize is definitely a skill. There was that one question. I'm just going to ask it now, and then we'll head towards a wrap up. But just you had mentioned CCAN. There's questions in the chat about CCAN and how people can find that.
So we're in the process of making it available online. Right now is hard copies. So how about when it's available online, which won't be till the fall, because everybody seems to be on holidays now. I will let you know to put up the link, just because we right now only have hard copies. And it was anyway, because we need to put it up. Because we're in the process of changing all of our Baycrest website. Like that's part of the issue. So I will let you know so you can pass it along. And
now, yeah, thank you, Adriana. One question, with if there's anyone on the webinar on the call today who really resonated with a caregiving situation that Baycrest in particular supports in terms of aging adults or dementia, you have a big focus in those areas. Is there a family caregiver newsletter or what's the best way for them to kind of stay in touch with what your organization is doing. For example, when that comes out in digital copy, would there be a newsletter about it kind of thing?
So we don't have a newsletter like the Koschitzky. We don't. And Baycrest does a lot in different areas. So we have a big research program, we have a clinical program, we have a hospital for older adults, tertiary care, a long-term care facility. It's just going to the website. We don't put out, because we do have newsletters, but for different groups. So we have for families of people in our long-term care, or for people in the hospital, or we have outpatient services. We have a day program, so they get their own newsletter. But just to the public, there isn't something, but I'm going to actually speak to our marketing VP, because shouldn't we be sending something like that? I mean, I think that would be great. It's just that we do so many things at so many different levels, that to target the right people. But you can also try our website. You could try Koschitzky Center for Innovations in Caregiving, as I said, and you can always reach out to me if you have a question. And we're a very big organization, and sharing all of what we do is difficult, but something we could do.
That makes sense. That makes sense. I actually put the link into the chat for people directly to the website, as you were mentioning, and not to put more work on your plate to get a newsletter going. I didn't mean to do that.
Well, I mean, no, it's kind of like it's on our, we're a small but mighty team, and we have so many projects, and my motto is to under promise and over deliver. And so, but I hear you.
No, thank you. I hope that everyone enjoys the rest of your day and your week. And thank you again for being here, Adriana.
Thank you. It's my pleasure.